My name is Dr. Sindisiwe Van Zyl. I'm a GP and media personality with a special interest in HIV and women's health.
Initiating the conversation around sexual health is not always easy, so I'll share some do's and don'ts that have helped me when I discuss sexual health with patients. Put aside your prejudices, your biases, your religious convictions, and any other things that may deter a patient from speaking to you. You don't want to judge anyone because that is not our place. What we want to do is that we want to help.
Respect patient views, opinions, beliefs, and feelings. Avoid being judgmental.
What you don't want to do is you don't want a person to leave the pharmacy none the wiser about their health condition. So please make sure that patients understand exactly what needs to be done, they understand why it needs to be done, and how it needs to be done.
Take time to listen to the patient. Practice active listening and reflection, reiterating what the patient has said in your own words.
The other thing that you don't want to do is to speak very loud in front of everybody, because again, that makes patients uncomfortable. So do make sure that you remain neutral and you consider patient confidentiality.
Being aware that you're asking difficult questions and doing so appropriately. Asking about relationship status.
So relationship status is not necessarily our business. So when I ask a patient about their relationship status, I'm asking to know who else within their sexual network is going to need healthcare. You're not asking to judge them, because that's not what they're here for. You're asking to make sure you know exactly how many people within that sexual network are going to need to come in for testing or going to have to be referred for testing wherever else they are.
Speaking to patients who have experienced trauma.
These patients need to be treated with the utmost sensitivity, and this means that giving them enough time to speak about what has happened, making sure that they know where to get further help, if they need to contact the South African Police Services, if they need to contact a rape crisis center. When you do get a chance to refer further, make sure that people get counseling, they go for trauma counseling, and of course if they have to see the police and fill out a sexual assault kit, please make sure that's also done. Race is also an issue. I think in South Africa, we are quite sensitive about matters of race. Be mindful of what you're saying. Be mindful of how you refer to certain conditions or how you refer to the HIV pandemic as a whole. Please make sure that you're sensitive, that you're not judgmental, and that you get all the information that you need from the patient in front of you.
For Each Other is our commitment to an HIV-free future. Share your story on #ForEachOther. Connecting keeps us strong. Find out more at www.foreachother.org.za.